Talk about the basilar artery. Basilar artery is going to arise by the union of two vertebral arteries, and it is going to ascend in a groove on the anterior surface of the pons. At the upper border of the pons, it is going to divide into two posterior cerebral arteries. Now let's talk about the branches. So when basilar artery comes in your paper, you're going to remember the lapse of time. So lapse is actually a mnemonic for the branches. L is for the labyrinthine artery. So the labyrinthine artery is going to supply the internal ear, internal acoustic meatus, and it can also arise from the anterior inferior cerebellar artery or ICA. And it is going to accompany the 7th and 8th cranial nerves into the internal acoustic meatus. Now let's talk about the pontine artery, which is also a branch of the basilar artery. Pontine artery is going to supply the pons. It has this posterior cerebral artery, which is the largest branch, and inferior cerebellar artery and superior cerebellar artery. So posterior cerebral artery is actually the largest branch, and from the lateral and backward side, it is going to curve around the midbrain, and it is joined by the posterior communicating branch of the internal carotid artery. So let's talk about the three branches of the posterior cerebral arteries of the basilar artery. So the cortical branch is going to supply the cortex, so the infralateral and the medial surface, temporal lobe, and the lateral and medial surface of the occipital lobe are going to be supplied by the cortical branches. The central branches are, of course, going to supply some nuclei. So let's remember the GLT for that. Antiform nucleus, T is for the thalamus, and G is for the geniculate body, which is specifically the medial geniculate body. And then in the end, we have another branch of the posterior cerebral artery, which is the choroidal branch. Choroidal branch is, of course, going to supply the choroidal plexus and also the third ventricle. Talk about the other branches, which are the anterior inferior cerebellar artery. So its supply is going to be similar to the pica or the posterior inferior cerebellar artery, except that it is also going to supply the pons. So remember CAM for that, CMP. So it is going to supply the cerebellum, the anterior inferior parts, the medulla oblongata, as well as the pons. Now let's talk about the superior cerebellar artery. Of course, it is going to supply the superior part of the cerebellum, and it is also going to supply the PSP. So S is for the superior medullary velum, P is for the pineal gland, and another P is for the pons.